the base on some other taxes in order to be able to do that in a dramatic fashion. But the specifics, I think, are still to be worked out. I would say that now is probably not the time to be looking at those sorts of efforts as a way to raise additional money in the upcoming fiscal year. The last thing we need, it seems to me, and there may be disagreement amongst some folks, but it seems to me the last thing we need is an effort to actually pull more dollars out of the private sector in an effort to further grow government, which is what I think the governor's budget does and what the Senate budget does, and we'll have to see what the House budget does.
A couple of nuances here. We're all in favor of lowering the rate, and then of course to do that they broaden the base. But the question is, how do you ensure that the rate stays lowered and it's not just bait and switch? That's the key problem. The second problem is, if you do it to pure services, that of course we already tax services. It's called the income tax. And the income tax, of course, you get deductions and adjustments based on your cost, but a pure sales tax on services is in effect an income tax on gross income as opposed to net income. So if it's at a very low level, it might make sense, but at a more substantial level, it's not really good tax policy. Laura.
As you know, the State Health Plan Reform Bill is scheduled to be up on the House floor today, and there was some serious Republican opposition to it in the Senate, and I'm wondering, is this a caucus issue? And if so, can you explain what your concerns about it are?
That's, I guess, to me, because
yeah, to either.
Yes, because the House will be voting on that today. The Republicans are very unhappy with it, and a couple of the reasons we're unhappy. If you'll recall, in July of last year, we offered an amendment. I'll be passing it out on the floor today to remind people, that would have directed the governor to begin affecting savings last July of 1%. That would have saved $200 million over the biennium, which is approximately this year's shortfall. And we were explicitly told by the Democrats, as they mustered a party line vote against the amendment, that this could wait till the fall, and by that they meant after the election. And we just think they were irresponsible on that. The second thing that I think, there are some good features in the bill, like the change from the calendar year from the fiscal year, but it doesn't really get at making health insurance more affordable by keeping people healthier, and it doesn't improve the situation of driving out younger dependents who would make money for us, because it raises their premiums. It doesn't do things like age rating. There's a lot of things it doesn't do. So I would say the Republicans are unhappy about it, and I'd be surprised if there were any Republican votes for it.
I think the other thing that is part of the reason for the Republican unhappiness is it really doesn't solve the problem in any kind of long-term fashion. What you're looking at is a fix that pulls a lot of money from the taxpayers, pulls a lot of money from the employees, and yet leaves the health plan in a situation where we're going to be dealing with it again next year or the year after.
Is there a way that you would recommend to fix it?
I think we've got to. Dale probably knows more than anyone within our caucus.
I don't doubt that.
But did you want to take that one, Dale?
Sure.
We all know what the long-term solutions are. We just have to put the policies in place to enable to make that happen. There's at least a 4-step process. The first step is that we change the vesting period. The second step is that we have, at least at this point, got the calendar year in there. There's so many positive things that can happen to attract young, healthy people to our state health plan by getting it on the calendar year. We have states to our south and to our north that are all doing this and have found ways to create high deductible, low premium options for our young employees. Once we do that, we'll start setting the stage for not only dealing with that side of the issue, but people my age, where we can reward them for focusing on their health and not their health care. And that goes to prescription drug benefits, understanding their chronic diseases, BMI, and all the other things that go along with that. But we have to change the behavior of what it is we're trying to fix. And The calendar year is the second step. The third step will be an enrollment audit to make sure that the people who are on the plan are the people who are supposed to be on the plan. So there are lots of things that can happen going forward, and we're excited about being part of the solution of doing those things.
One other issue that I know is dear to Dale's heart is the retiree problem, where we're $28 billion on accrual basis in the hole. Maybe not present value, but 28 billion.
29 billion.
Oh, I'm sorry, 29 billion. Starting in 2003, every time we'd have a budget, when we had billion-dollar surpluses, we would stand up on the floor and say, with $1 billion or $2 billion, whatever it was that year, with the surplus this big, you are not putting one dime into the retiree health care. It's just totally irresponsible. And we said it in 03, we said it in 04. I remember a speaker standing up and waving a picture paper and saying, we don't need this distraction from our real work, you know, when we ask them to do that. It's irresponsible not to have done it in the big years, in the boom years. Might be a little tougher this year. But they could, you know what they could do? Symbolically, they could put $100 into that fund to show that they mean it. Representative Falwell actually had a bill in 2005 and 7. In 2007, to put $100 in that fund to show that they actually intended to do it someday, and they wouldn't even hear his bill.
I think a better answer to your previous question is that for decades we have not taken care of our responsibility to our future retirees. We've been making promises that we cannot keep regarding retiree health care. And what you're seeing now is that we are trying to finance our obligations that occurred in the rearview mirror on the backs of families who work for the state of North Carolina. And that's wrong, and that's what we've got to try to fix.
Other questions?
Do
Kelly?
you believe you can even fix that or even catch up at this point at $29 billion? Or do you need a fundamental change like we're seeing with the car manufacturers and the legacy costs? I guess what we're talking about.
Well, you're not required to fund it all at once. And unfortunately, we can't go into bankruptcy and get rid of the obligation that way. And it's a contractual obligation that, according to our state Supreme Court, we cannot avoid. So we just need to start putting money into it.
And Kelly, it's all interrelated with the budget. There's got to be some discipline in those years where you have additional funds that may be spent. You've got to care for these long-term obligations at that time, rather than creating new programs, rather than growing spending at rates that far exceed inflation and population growth. Other questions?
Your proposal would have had hundreds of millions, if not billions, that could have gone into it over the last 10 years.
There would have been money if we had exercised, or if the Democrats had exercised some spending discipline over the past 10 years when we did have good economic times. And that's, I guess, the overall message. I'd be remiss if I did not give credit to someone as far as the proposal in Senate Bill 1052. Senator Bill Golston is a retired senator from Rockingham County, Democrat, who originally made this proposal during one of our previous spending crises back in 1990. And he was not listened to at that time. If he had been, we would have not gone through the problem we had in 2000, 2001, and would not be going through the problem we're going through now. Hopefully the Democrats will listen to the proposal at this time. Thank you very much.
Thank you.